gotta get this done. I gotta get back to my stuff.
Anthony Suda. Jose Narciso.
Winston Navarro. Staff Sergeant Parker.
PMC Carmichael, Timothy L.
Hi, my name is Mark Wolf, and as you may know, I'm a medic in the United States Army. Today I want to talk about acupuncture, but first, I'm going to tell you a story about a friend of mine who had chronic back pain. This friend would go to doctors, chiropractors, massage therapists to try and get rid of this pain, but after a while these visits became far too expensive for him to afford. He then made a visit with a doctor who referred him to an acupuncturist. My friend met with the acupuncturist and they talked about the process, the actual procedure, how it worked, and that it wasn't a guarantee, but it is a viable option to rid himself of the pain. My friend came back to the acupuncturist for this first session and he came with pain in his back. After the session was over, he left without any pain. The acupuncturist told him to come back every couple of weeks for the next 4 months. Whether he had pain or not, it was part of the process of healing. So my friend came back every 2 weeks to the day for 4 months, whether he had pain or not. And at the end of the 4 months, the acupuncturist told him, I think that you're cured of your pain, your ailment. My friend said, I haven't had any pain in the last 4 months since the first treatment, and he was convinced that he didn't have any pain. Now don't get me wrong, my friend could still have pain if he shoveled the driveway or if he raked some leaves or something like that. Everybody would, but it's not the same type of pain that he had before. Now how many people do you know that have chronic pain, whether it's lower back, abdominal, shoulders? My brother would get migraines all the time. This acupuncture is probably a good option for everybody. You may be wondering what acupuncture actually is. According to my MacBook dictionary, acupuncture is an alternate practice of medicine that involves pricking the skin, similar to these pictures here, and doing so alleviates pain. It's also used to treat various physical, mental, and emotional conditions. I want to go over the history a little bit of acupuncture, where it originated, things like that. Also how it works, the theory behind acupuncture, and why it's considered an alternate practice of medicine. According to Arthur Brown, in his book Treatise on Acupuncturation, Inoculation, Diversion and Medical Administration, he says that the first recorded use of acupuncture was over 8,000 years ago in ancient China. But it's first written about in the Nai Xing, which translates the first book of internal medicine. And in this book, it talks about the pathways of energy and how when they're disrupted, you become diseased or have some type of pain. Now, acupuncture wasn't always done with these types of needles that you see here. It was first done with stones. These stones were called biome stones. They were sharpened down to such a point that they would be able to infiltrate the skin and be left in place. Now, more recently, bronze and gold stones have been excavated from a ruined dig in China. During 627 AD to 649 AD, Sun Simio wrote a prescription for 1,000 gold for emergencies. And because of this book, acupuncture has become a special branch of medicine. There were schools popping up everywhere, and education was actually put in the Empirical Medical Bureau. And in his book, he also noted the 657 points of acupuncture, and they range anywhere from an inch apart to a quarter inch apart, and they're all over the body. As you can see in this illustration here, there's many on the face and wrists, all up and down your back and shoulders. Now, how acupuncture actually works is their theory is that there's channels of energy flowing through your body. These channels are called meridians. And Courtney Witherspoon calls acupuncture an energy treatment and energy medicine. triggers nerves, which send signals to your pituitary gland, your midbrain, and your spinal cord that that trigger a release of serotonin or norepinephrine, and these are chemicals that block pain messages to your brain. Now, there's also been many studies in the West that try to explain or undergo which diseases or anything like that acupuncture will work best for. Many of the studies are